I once had a patient with low back pain. He was a retired and disabled vet, and he spent most of his afternoons at his daughter's soccer practice, watching all the kids run around, but he just sat there on the bleachers. And then one day he made a small change, which completely transformed his life. When I first met him, and he was in his mid-40s, he had recently retired from the Army. He was a gigantic guy. He was probably 6'4", weighed well north of 300 pounds, and he had dedicated his time to his daughter since he'd retired. He said to me, "I was gone for so much of the time when she was younger that now that I'm home and retired, I want to spend as much time as I can with her." And so he would spend most of his afternoons at his daughter's sports practices. She played a lot of different games, but usually it was soccer practice. I knew him because I was treating him for his low back pain, and he had fairly typical findings for somebody his age, and with his work history. He had some mild wear and tear degenerations in the spine with disc bulging and with arthritis in the facet joints. I wouldn't categorize any of it as severe, but it was severe to him. It significantly limited his activity, and it left him spending most of his day just sitting watching rather than participating. But he decided one day to get up and start moving while his daughter was playing. He said most of these practices ran for 2 or 3 hours, and instead of sitting there staring at his phone and watching the game, he decided to just get up and walk around the track. He said that at first his knees hurt, his legs hurt, his back hurt, and he was limping as he made his first round on the 440. Over the next few days and weeks, it got easier and easier and easier. He still came to see me, and I still treated him for his low back pain, but he didn't really complain as much about pain anymore, and he started rating his pain scores as lower and lower. At some point, he just kind of disappeared from my practice, and I didn't give it a whole lot of thought until I heard his voice at the front desk as I was walking around the corner. While I say I heard his voice, I could hear him, and I had a picture in my mind of who he was, but the person at the front desk didn't look anything like the patient that I had been treating. This is a fairly common picture of a patient that I treat. When pain goes on for a long time, the body starts interpreting all activity as damaging and all sensory input is pain. It's like the volume knob gets stuck on high and it can't be turned down. Patients come to see me and we'll use medications, we'll use specific physical therapy approaches, and we'll use diagnostic and sometimes therapeutic injections to try and bring the pain under control and restore normal function. But often there's a missing piece, and that's the patient's own activity. When somebody has chronic pain, what happens is there's repeated activity which activates the A delta and the C fibers, and these fibers release neurotransmitters. These neurotransmitters then activate NMDA receptors, and they sensitize certain pain fibers to transmit pain more effectively. The pain gets transmitted up the spinal cord and into the brain, and then it activates other areas. The pain travels to the somatosensory cortex. This is the area of the brain where the parts of the body are represented. Sometimes you'll see it as a figure called a homunculus with large lips and big feet and large hands. And what that represents is how much of the cortical neurons are used to interpret the information that's coming in from those body parts. So what happens with chronic pain is that the signals get amplified, as we've discussed, from the periphery and from the spinal cord. They travel to the brain. The somatosensory cortex then starts to over-represent them, over-interpret the information that's coming in. The insula and the anterior cingulate gyrus, this somatosensory information to the midbrain, and they assign an emotion to it. Usually the emotions that are associated with this painful signal are fear, vigilance, anxiety, anger. The inhibited parts of the brain ordinarily suppress these signals and these emotions, and this part of the brain goes quiet. So you have a lot of input into the brain, and then you have dampened modulatory output, so that the brain experiences a lot of pain, assigns a lot of painful emotions, and then blocks the inhibitory pathway. So you get all pain signal in, no dampening going out. So in the end, what you have is a body that's trained not to move because movement aggravates the incoming pain signals. Your brain learns to limit activity because the pain signals that are being transmitted are painful, and the brain shuts down its ability to dampen those pain signals. And it creates a vicious loop where you hurt more, you do less, it creates more pain when there is any activity, and you do even less again, and you're basically left sedentary and in constant daily pain. So what happens when you reverse this process? Well, basically you retrain the spine and the brain to interpret the information correctly. First, you start to activate A beta fibers in the periphery. These are non-painful sensations, and they start transmitting that information to the brain. Then the GABAergic neurons are activated, and these act like gates. They close and they prevent the pain signals from the A, delta, and C fibers from even being transmitted to them. The movement also causes re-engagement of those areas of the brain that we talked about earlier that create the dampening signals that inhibit pain. And so those parts of the brain start to fire more, and they start to suppress the incoming painful signal. And over time, the microglia start to quieten down. They shift from M1 to M2, and they start to produce more anti-inflammatory cytokines. You get a reversal of the inflammatory state. You get dampening of the incoming pain signals. You get amplification of non-painful signals, and the whole system starts to reset. So what you have to do is you have to think of every step as a reset for the software in the brain. And the more that you do, the more rapidly the software resets, the more it shifts from amplifying pain signals to reducing pain and normalizing pain experience. So in this particular patient's experience, what happened was the normal neurotransmitter milieu took over. The substance P and the glutamate were suppressed, and we had enhancement of norepinephrine and GABA and serotonin, and the system normalized. There was also some physiologic consequences. He started to lose weight, and that's why I really couldn't recognize him when he came into the office. He'd lost over 100 pounds. He appeared to have gotten younger in the time since I'd seen him last. I talked to him for a little while, and he explained that what happened was he started walking, he started feeling better, he started walking more. He actually began to run at that point. As he started to feel better, he was motivated to do things differently. He changed his diet, he changed his habits, he put his phone away, he started engaging in activities that he previously enjoyed, and the whole system normalized. His spine didn't look any better on imaging, it just hurt him quite a bit less. His nervous system stopped shouting danger signals at him all day long and just started to listen to the regular input. He still experienced aching and normal aches and pains with activity, but he no longer experienced them as painful. He considered them healthy and signs of improvement, and that completely changed his outlook, and it completely changed his motivation. Pain isn't just in your back. It's a conversation between your nerves and your brain, physiology and your chemistry and your choices. Movement sends an entirely new set of signals through the system. It's one of safety, not of threat. And when you repeat this message long enough, your brain will rewire. That's why recovery isn't something that you get, it's something that you become. If you'd like to learn more about your own back pain, check out painoptics.com. I'll include a link below.